But if the state can demonstrate a strong connection between a safe and effective vaccine and reducing the death rate, the illness rate, and the devastating impact the disease has, I think the Supreme Court would sustain that. And I think most civil libertarians would agree. Others were very thoughtful. I got a very thoughtful response from Bobby Kennedy, who I've known for a long time. In fact, we agreed to debate this issue now because I think it's a debatable issue. Yeah. And I would certainly never try to stop anybody from expressing anti-vaccination views. That's part of the dialogue, part of the debate. We should encourage debate and dialogue while also encouraging science to develop an effective and safe vaccine.
Like that. So vaccinations sort of fall into a really different category where we're starting to take away consent or informed consent. It doesn't matter after you've been informed of whatever possible good or bad. You know, when we came out of the Nuremberg trials, of course, the Nuremberg Code says you should be involved in that decision, that you should be told all the benefits and all the negative side effects, and then and only then you are the one that gets to make that choice. And the way you discuss vaccination really overrides the Nuremberg Code and says, no, when it comes to other people's health and you're putting them at risk, then we can override your choice and your need to be informed.
I would exempt people who have a medical problem, which would be exacerbated by taking the vaccine. I mean, if the vaccine is the norm, it's what we've accommodated our laws to, certainly for the last 150 years since the vaccines for smallpox were developed. It would take a change of the law now to say that we're not going to mandate vaccines if they're safe and effective. Now, I wouldn't compel them unless there was extensive testing, unless the consensus was overwhelming that it was safe and effective. But if those criteria were met and legislation was enacted by a majority and upheld by the courts, then I would go ahead with the mandate without exceptions, except medical exceptions.
I mean, you have to imagine, I mean, I would guess that that really is in jeopardy when we see how this is being described, that they are rushing the science. Dr. Fauci said that we have skipped animal trials and that we are going to attempt to have this vaccine in 12 to 18 months. Donald Trump is now saying that we're using a warp speed approach and that he hopes to be able to have the military able to deliver this vaccine by autumn. Now, you seem to be well aware of the fact that, you know, when we look at science, when we look at pharmaceutical products, usually those are tested using a double-blind, inert placebo study. That's something that already most of these vaccine trials are not doing, particularly the Moderna, which is the leading product right now, does not have a placebo group. Does that bother you at all that we're rushing science and not really using the scientific method as we know it?
Well, I think we ought to rush the science, and then I think we ought to be very, very careful. And I would try to get the vaccine as soon as possible, but I would not impose it on people right away. I would start with voluntary compliance. I would expect that most people would want to get it. But if a person refused to get it, I would certainly allow those people to get at the end of the line and wait until we had double-blind testing and placebo tests and all of that. I think you do have a right to demand of your country that they follow the scientific method, but I suspect the risk-benefit ratio is a little bit different. So I would go to my doctors and I'd make a medical decision, a careful decision, and would take the vaccine, but I wouldn't impose it on my children and my grandchildren until we were probably a little further along in the testing process. So I don't think we should be rushing to plunge needles in the arms of the most unwilling people first. And I would encourage debate. I would encourage more debate. I've agreed, as I said, to debate Bobby Kennedy, who's an old friend. I was somebody who worked with his father many, many years before that. I worked on his campaign when he was murdered. I'm a great admirer and friend of many of the Kennedys. And I'm looking forward to my debate with Bobby. We are two reasonably intelligent people who can disagree and still have a friendship after our disagreement. And I'm willing to learn from him. And maybe I'll change my mind about certain issues, and maybe he'll change his mind.
If this follows the course of MERS or SARS or every other coronavirus we know, it will be gone on its own within 2 years. So it seems like it will be anticlimactic to finally, be bringing in a vaccine mandate at the point where this thing has handled itself naturally. But I think that's a different point.
I stand by my view constitutionally that the state does and should have the power to compel people to do things against their will if it's necessary to protect against highly contagious, deadly disease. And reasonable people could debate how contagious, how deadly, all of these things that we've discussed today. But the principle, I think, is an important one.
Right. When we talk about children, you pointed out something really clearly, that we don't know this virus, how it will affect them years down the road. But the same could be said about the vaccine. When we are talking about a vaccine that I would imagine, if it's going to have any effect on COVID-19 at all, will have to be mandated, for everybody within 2 years or so. So that means we will have no ability, there'll be no science that exists to show the long-term safety implications or health implications of children who, as far as we know, had no issue with the illness. We don't know if the vaccine is going to have long-term issues. We also don't know, for that matter, any adult. When we're talking about rushing this, I think you made a really good point. We don't know what the long-term effects of the illness are, except that we do have a historical reference of what happened with people who've had coronaviruses since the dawn of man, what happened when they got SARS, when they had MERS. We have no idea what will happen to people who get the vaccination. So let me ask you this question, because I do want you to be thinking about these things, because you probably are going to be a voice talking about this. So here's the question. When you say that the FDA, CDC will determine it's safe, and therefore that's the time, we've done the trials, but always in trials you can't test everybody. And in Moderna's, which is the leading contender right now for the vaccine, they've already excluded people out of their trials because they're going to be at higher risk for having an adverse event, I would imagine. So they are not allowing people with cardiovascular disease. They're not allowing people with obesity into the trial. They're not allowing people with respiratory illnesses. And so I wonder, if we get to the point where we are now going to mandate this vaccine, would you consider then allowing people that have heart conditions or diabetes or obesity to be those that cannot be dragged to a hospital and have a vaccine rammed into their arm?
It's a fair point. It's a fair point. I think it would be fair to argue that anybody who was not part of the group that was subject to the testing, there's not enough medical and scientific basis for compelling them to have the vaccine. That seems to me to be a very fair, scientific, as well as legal point. I think these conversations should continue, and all of these points are good ones that should be included in the dialogue. So thank you very much for a very intelligent conversation about a very complex, difficult, and important issue.
Well, and you see the difficulty, right? Because to make a blanket statement that anyone could be taken and forcibly vaccinated, when we talk about heart disease, that's going to be over 40% of America. When we look at autoimmune disease that's excluded from these trials, that's another 10%. If we get into respiratory illness, so you start seeing that the vaccine is going to have a very difficult time achieving herd immunity, which is the goal. So when you say that this is how the vaccine should be used, I don't see how we get to that goal if we start taking rights away from people where it hasn't actually been properly tested for safety, because I just don't think that we don't see that. So I appreciate you looking at that. One last question, really.
My point is that we ought to expand the testing. Everybody my age, I'm 81 years old, has some problem, some medical problem somewhere, and yet I want to take the vaccine. So I'm going to follow very carefully who's tested, who's not tested, and hope that there'll come a time when the test will include people within my category so I can safely test it. So again, I think it's going to be a process. It won't be black and white, yes or no.
Well, and my opinion, just so you understand it, is I would really like the focus for these great scientists around the world to make a product exactly for you, for this percentage of people, the 1% that are having any acute reaction at all. When we hear across the world that 99% of people clear this illness without any long-term effects, it seems to me ridiculous to make a product that 99% has got to take a risk with, has got to get involved with, even though there haven't been safety studies. I would really prefer they make a product that's tested and designed especially for those at risk like yourself. That's my perspective. Let me ask you one last question.
Just one point to make sure your people understand that 1% of the world population is close to 100 million people.
Right.
So That's a lot of people to put at risk. If 99% are safe, we don't want to put at risk 100 million people.
No, but that's my point is we should be making a product for that 100 million people,
Of course,
not for the
of course,
7.5 billion people that the other, that don't really need it. And so that's my perspective. It's an important voice. I really appreciate you taking this time to sort of explain where you're at. But
I've learned a lot from your questions. I mean, you've asked some very all fair and very probing questions, and I think we should continue to have this debate and this dialogue, and let's make rational, calculated decisions, and let's turn people against each other. But I've learned a lot from our conversation, so thank you very much for inviting me on for intelligent conversation.
I really appreciate it.
Good. Too rare. Good. Thank you.
I agree. We need to do more of this. Thank you so much for your time and for the clarifications. I appreciate it.
Right.